Hello, I'm Dr. Ann Sephton. I'm the clinical lead of Bristol, North Somerset and South Gloucestershire Community Education Provider Network, and I'm a GP at Cadbury Heath Health Centre. Our bid is to provide a decision support tool to support monitoring and repeat prescriptions. The problem is that this is a very large volume piece of work across primary care and equates to about 84,000 repeat prescriptions a week in Bristol, North Somerset and South Gloucestershire, and there is an enormous variation in the way this work is approached across different practices. We're aware that lots of different practices are trying to develop their own solution to these problems, which is a very time-consuming piece of work. We are aiming to provide an EMIS-based, dedicated piece of software that will remind people who are issuing repeat prescriptions of all the monitoring requirements, the review requirements, and what medications shouldn't be prescribed because they should now be available by patients to buy over the counter. We know that there is a significant error rate in repeat prescribing. It's been estimated as up to 40% of repeat prescriptions have an error. Probably the reality is nearer 7 to 10%. However, there is evidence that a dedicated support tool helps to reduce errors in prescribing, although this has not been demonstrated in primary care and not with repeat prescribing. We have a very early prototype of the software currently working in a single practice on the EMIS software, and we are aiming to have a dedicated IT team to support the further development of the software. We are going to have a clinical work group that is going to review the clinical requirements and monitoring requirements to put into the database. We're going to use various techniques to implement the software across BNSSG, which will mean getting senior level buy-in, getting training opportunities with the practice managers and GPs, and also with the prescription teams. And we are going to have ambassadors from each practice who are going to work with us to develop and to implement this solution. Our aim is to have a structured and uniform approach to repeat prescriptions across the patch to improve the efficiency and standardisation of repeat prescriptions, reducing errors, reducing waiting time for patients, and reducing the time spent by practices all trying to invent their own systems.